Since it was founded over 60 years ago, the National Health Service has been a key public service benefiting the lives of millions. Looking ahead, we aim to continue to maintain and improve on the healthcare we provide. But we face a number of challenges. The NHS in South West London is addressing those challenges right now at a local level, and we'd like you to consider them with us. Our population in South West London is growing. It's estimated that the number of births will rise by over 10% over the next 5 years.
20 years ago, the average family in Wandsworth that I saw had 1 or 2 children. Now I'm seeing more and more families from across the social spectrum having 4, 5 and 6 children.
Because the birth rates are going up, we're having to look at maternity services to try and support that, looking at community midwifery to make sure that the births that are predicted are going to be supported in the future.
As well as more births, we're living longer too. It's estimated that the number of people aged over 85 will have doubled by 2029.
Last week, 3 patients came to see me, all over 90, in the same surgery. That was unheard of 10 years ago.
60% of men over the age of 60 will have prostate cancer. So as the population ages, more and more men are being diagnosed with prostate cancer.
We're seeing a lot more patients over 90 wanting joint replacement. That age group do fall more often, and that's mopping up a whole raft of services that weren't expecting such a workload.
Whilst we're living longer, we're also more prone to long-term health problems. Eating unhealthy fast foods, excessive drinking, and lack of exercise are also contributing factors. And though generally the numbers have been going down, 1 in 5 people still smoke.
The number of patients who I see now who have illnesses associated with their weight has increased phenomenally. People who've got arthritis, diabetes, heart disease. I'm now offering patients the option, again and again, of weight reduction surgery, something which we did once a year 10 years ago. Now every week someone's referred to have an operation to reduce their weight. Also, smoking continues to have a devastating effect. Every week I sadly see a person with lung cancer or heart disease solely determined by their intention and continuation of smoking.
And in my line of work, I see a lot of men and women with bladder cancer, which has occurred because they smoke. Dealing with those individuals is of course much more difficult if they're obese. So the contribution that we can make to our own health is important.
As well as needing more from the NHS, we also expect more.
We're becoming increasingly consumerist in our society and in our expectations of the health service. And this is illustrated by people who will often attend the accident and emergency department in their local hospitals with complaints which probably could have waited a day or two to see their own GP.
People expect to have a scan. If you come in with abdominal pain, you will get a CT scan. CT scans cost a lot more than an ultrasound, that costs a lot more than a surgeon feeling your abdomen. So as technology moves up, the cost of one admission can be very, very steep.
As a nurse, I feel like I always want to provide the care that the patients expect, and it can become very frustrating when you want to spend time showering a patient, washing their hair and blow drying it, but unfortunately you have 6 other patients to deal with, and that's not always realistic.
The NHS continues to make use of the most effective and up-to-date technology and medicines. But the cost of drugs and cutting-edge equipment is also going up.
Many cancer sufferers are now treated with life-saving or life-prolonging drugs, but these drugs are often very expensive. Technological advances in surgery mean that procedures which we used to do involving cuts on the surface of the body to get at the organs inside can now often be treated with keyhole surgery. This results in a much shorter hospital stay and a much quicker convalescence for the patients. But of course, it does cost more money.
As a nurse who started her training in 1980, in the last 4 years I've learnt more about money than I'd ever learnt in my life. Every ward sister has her own budget now. And I wouldn't say it used to be the land of plenty, but we are very careful that we don't waste anything.
A knock-on effect of these advances in healthcare is that more staff need to be more highly trained. This extra demand can lead to staff shortages.
At Sutton Merton, we have invested heavily in the use of Rio, so now we've got all of our district nurses, community rehabilitation staff using the same clinical record via our IT system. It's been hugely beneficial to patient outcomes, but the only concern we've had is ensuring that these staff feel suitably trained to use the system.
Within the practice, we're looking after our chronic bronchitic patients more and more. So that means that we're having to train up our staff within the practice around being able to do spirometry for our patients, making sure that they're able to read the results of the spirometry and access the specialist advice as and when is required.
It's very difficult to get special baby care nurses and ITU nurses because there is a shortfall in nursing staff generally, and it costs more to train them. What we're looking at now is changing our staff profile so that the staff who previously never went into a specific area will now multitask.
There's also the issue of inequalities in our health. This can be due to differences in living conditions and how early people can access good healthcare.
I work in Tooting, which has got some very affluent areas feeding into it, but also some very socially deprived areas. And we see completely different levels of health in those two populations. The NHS has a responsibility to try to improve both access to healthcare and lifestyles of patients from socially deprived areas, so that hopefully we can reduce the disease burden on that population and of course demands on the health service.
Diabetes is increasing throughout the UK, but increasing in Wandsworth probably even faster. If we can prevent their diabetes, we can make them live longer, we can reduce blindness, we can reduce kidney disease, we can reduce dialysis, we can save money and improve life. A benefit for them, a benefit for the whole community.
Unmet, these challenges together mean that by 2015, the NHS in South West London will need to find more than £125 million beyond its likely budget. So there's a real need to look for ways to continue improving the healthcare we provide whilst being as financially efficient as possible. We're interested in hearing your views on these challenges, so you can help us think through what will work best for your NHS in South West London. We look forward to hearing your thoughts.